You wake up every single morning, and the first thing you do is not say good morning to your family. The first thing you do is clear your throat again and again and again. That thick, stubborn, annoying mucus sitting right there at the back of your throat like it owns the place. You cough, you hack, you try to swallow it down, nothing works. And by noon, it is back again. By evening, it is worse. People around you are starting to notice. Your coworkers hear you clearing your throat every 5 minutes. Your partner is losing sleep because of it. And you are just exhausted. Exhausted from constantly feeling like something is stuck in your throat that never goes away. Maybe you have already tried everything. Antihistamines, nasal sprays, cutting out dairy, drinking more water, steam inhalation, you name it, you have done it. And still, that mucus is there, mocking you every single day. Here's what nobody is telling you, what your family doctor might have missed, what the internet rabbit holes will never clearly explain. That constant mucus in your throat is almost never caused by what you think it is. It is not just allergies. It is not just a cold that never ended. There is a hidden cause that millions of people are walking around with right now, completely unaware. And today, I am going to pull back the curtain and show you exactly what it is, why it is happening inside your body, and most importantly, what you can actually do about it. My name is Dr. Jennifer, and I have been practicing internal medicine and ear, nose, and throat consultative work for over 15 years. I have seen thousands of patients sit in my chair, frustrated, misdiagnosed, and desperate for answers about this exact problem. So sit tight, because what I am about to share with you could genuinely change the quality of your daily life. Let me start by explaining what mucus actually is, because most people think of it as the enemy. It is not. Mucus is your body's best friend. Your throat, nasal passages, and airways are lined with specialized cells that produce mucus around the clock, about 1 to 2 liters of it every single day. Yes, you read that right. 1 to 2 liters. You swallow most of it without even knowing. Mucus traps bacteria, viruses, dust, and allergens before they can get deep into your lungs. It keeps your airways moist and protected. Without it, you would be in serious trouble. So the problem is not that you have mucus. The problem is that your body is producing too much of it, or the mucus is becoming too thick, or your ability to clear it is impaired. And when that happens, it pools at the back of your throat, a condition doctors call postnasal drip, and it creates that constant sensation of something being stuck, the need to clear your throat repeatedly, and sometimes even a chronic cough. Now, here's where it gets interesting. Most people, and even many general practitioners, immediately jump to allergies as the cause. And yes, allergies can absolutely cause postnasal drip. But here is what the research is now showing us very clearly. The number one hidden driver of chronic mucus in the throat is not allergies at all. It is acid reflux, specifically a form called silent reflux, or what we medically call LPR, laryngopharyngeal reflux. Let me paint you a picture. Imagine you have a neighbor who throws loud parties every night. You cannot sleep. You are constantly irritated. But here is the twist. These parties happen silently. No music you can hear, no obvious noise. You just wake up feeling terrible every morning and you have no idea why. That is exactly what silent reflux does to your throat. Unlike the classic acid reflux that most people know, the heartburn that burns in your chest after eating a greasy meal, silent reflux sneaks up to your throat without you even feeling the acid burn. The stomach acid and digestive enzymes creep up past the lower esophageal sphincter, travel all the way up the esophagus, and reach the back of your throat and even your voice box. But because the throat is less sensitive to acid than the esophagus, you do not feel that classic burning sensation. What you feel instead is mucus, constant, relentless, throat-clearing mucus. Here is why this happens on a biological level. When acid touches the delicate lining of your throat and larynx, your body goes into protection mode. It signals the mucus-producing glands to go into overdrive. Your body is essentially trying to coat and protect the irritated tissue with a thick layer of mucus. It is a defense mechanism, a brilliant one actually. But from your perspective, it feels like pure misery. Now, I want to give you a real-world example that I see in my clinic regularly. I had a patient, let us call him Ahmed, a 42-year-old school teacher. Ahmed came to me after 2 years of constant throat clearing. He had been treated for allergies 3 times by 3 different doctors. He was on antihistamines, nasal corticosteroids, and had even done allergy testing, which came back mostly normal. He was at his wits' end. His students had started mimicking his throat clearing. His wife thought he was doing it on purpose as a habit. When Ahmed sat across from me and I asked him a very specific set of questions, the picture became clear almost immediately. Did he feel like something was always stuck in his throat? Yes. Did he have a mild hoarseness in the mornings? Yes. Did he sometimes wake up with a slightly bitter taste? Occasionally. Did he eat dinner within 2 to 3 hours of going to bed? Every night? Did he drink coffee daily and consume fatty or fried foods regularly? Absolutely. Ahmed did not have allergies. Ahmed had LPR, silent reflux. We changed his eating habits, elevated the head of his bed, and put him on a short course of acid-suppressing medication. Within 6 weeks, his throat clearing dropped by 80%. Within 3 months, it was essentially gone. That is the power of identifying the real cause. But let me be thorough here because I want to cover all the bases for you. There are several other hidden causes that contribute to chronic mucus in the throat that often go undiagnosed. The first is a condition called non-allergic rhinitis. Unlike allergic rhinitis, which is triggered by pollen, dust mites, or pet dander, non-allergic rhinitis is triggered by environmental irritants like strong perfumes, cigarette smoke, cold air, changes in weather, or even spicy food. Your immune system is not actually reacting to an allergen in the traditional sense. Instead, the nerve endings in your nasal passages are hypersensitive and they trigger mucus overproduction in response to these triggers. Antihistamines, which are designed to block the allergic response, do almost nothing for non-allergic rhinitis. This is why so many people try allergy medication and get zero relief. The second overlooked cause is a dysfunction of the muscles and nerves around the throat and esophagus. Think of your throat like a complex highway system with multiple on-ramps and exit ramps. When the coordination of these muscles is slightly off, mucus does not move through the system efficiently. It stagnates, it accumulates. This can happen after viral infections, after periods of high stress, or as part of a condition called globus sensation, where you feel a persistent lump or fullness in the throat, even when there is no physical obstruction. The third cause that rarely gets discussed is a hormonal one. Thyroid dysfunction, particularly hypothyroidism, where your thyroid is underactive, can lead to sluggish mucus clearance and increased mucus production. The thyroid controls the metabolic activity of virtually every cell in your body, including the cells that line your respiratory tract. When it is running slow, everything slows down, including your ability to efficiently move mucus out of your throat. And the fourth cause I want to mention is chronic dehydration combined with mouth breathing. This is incredibly common and incredibly underappreciated. When you breathe through your mouth, which many people do at night due to nasal congestion or simply habit, the air bypasses the natural humidifying system of the nose. The throat becomes dry and irritated. The body responds by producing thicker, stickier mucus. And thick mucus is much harder to clear than thin, well-hydrated mucus. If you are not drinking enough water throughout the day, and most adults are not, your mucus becomes the consistency of glue rather than water, and it just sits there at the back of your throat like a stubborn houseguest who refuses to leave. So now that you understand the real culprits, let me give you practical, medically grounded steps that you can begin implementing immediately. Step 1, elevate your sleeping position. If silent reflux is a potential cause for you, gravity is your best tool. Elevating the head of your bed by 6 to 8 inches not just using an extra pillow, but actually raising the entire head of the bed significantly reduces the amount of acid that can travel up to your throat during sleep. This single intervention has been shown in clinical studies to reduce LPR symptoms by up to 50%. Step 2, change your eating schedule. Do not eat within 3 hours of lying down. I know this feels inconvenient, but your stomach needs time to empty before you take a horizontal position. A full stomach under pressure is a recipe for reflux. Make this a non-negotiable rule for 4 to 6 weeks and monitor whether your throat mucus improves. Step 3, identify and eliminate your personal triggers. Keep a simple diary for 2 weeks. Write down what you eat, what you drink, and when your throat symptoms are worst. Common triggers for both silent reflux and non-allergic rhinitis include coffee, alcohol, carbonated drinks, spicy foods, fatty foods, strong fragrances, and cold air. Patterns will emerge quickly. Step 4, dash hydrate aggressively and breathe through your nose. Aim for at least 2 liters of plain water daily. If you notice you are a mouth breather at night, speak to your doctor about a nasal strip, a saline nasal rinse to clear your nasal passages before bed, or assessment for nasal obstruction. Nasal saline rinses dash simple saltwater rinse systems that irrigate the nasal passages dash are one of the most evidence-supported, underused tools for reducing postnasal drip and throat mucus. Step 5. See the right specialist. If your symptoms have lasted more than 6 to 8 weeks and basic lifestyle modifications have not helped, please do not keep suffering in silence. Ask your doctor for a referral to an ENT, an ear, nose, and throat specialist, who can perform a simple scope of your throat and larynx to visually assess for signs of acid irritation, infection, or structural issues. A proper diagnosis changes everything. I want to close with something important that I tell every single patient who sits in my office dealing with this issue. The body does not create symptoms without reason. That constant mucus in your throat is not random. It is not just bad luck. It is your body sending you a message repeatedly because you have not yet received it clearly. When we stop fighting the symptom and start listening to what it is trying to tell us, when we dig deeper and find the actual root cause, rather than just patching over the discomfort, that is when real healing begins. You deserve to wake up in the morning without immediately reaching for something to clear your throat. You deserve to have a conversation, give a presentation, or sit in a quiet room without that constant urge to cough or clear. You deserve to sleep through the night and wake up feeling like your throat is your own again. Whether your hidden cause turns out to be silent reflux, non-allergic rhinitis, thyroid issues, chronic dehydration, or something else entirely, there is an answer. There is a path forward, and it starts with asking better questions and refusing to settle for a diagnosis that does not fully explain your experience. If this video resonated with you, if you recognized yourself in what I described today, share it with someone else who has been struggling with the same frustrating cycle. Leave a comment below telling me how long you have been dealing with this and whether you suspected any of these causes before watching. Your experience might be exactly what someone else needs to hear to finally find their answer. I am Dr. Jennifer. I will see you in the next one. Take care of your body. It is the only one you have got.